Welcome to Med School. Our today's topic is CPR, Cardiopulmonary Resuscitation. So let's come to the topic CPR. Okay, the best guideline for CPR is given by American Heart Association, AHA, ACC, American College of Cardiology. So it's okay if general people don't know about CPR, but for a medical student, if he or she don't know about the CPR, then you are not going to save life of patients. So CPR is performed in an event of cardiac arrest, means when the heart stop pumping blood. Now understand the pathology of cardiac arrest. So what is happening is, with the last systole during the cardiac arrest, the pressure generated in the aorta makes the blood flow through the systemic circulation, and this circulation will be continued till this pressure becomes equal to the pressure of right atrium. Likewise happen in the pulmonary circulation. Pulmonary circulation will be continued till its pressure become equal to left atrium, and eventually the flow will stop in approximately around 3 to 5 minutes as per the recent research. So the first guideline of emergency response is chain of survival. So chain of survival contains couple of points. Number 1 is outside hospital chain of survival. Number 2 is in hospital chain of survival. So first we will go through the outside hospital chain of survival. The outside hospital chain of survival having 6 links. The first is activation of emergency response. Second is high quality CPR. Third one is defibrillation. Fourth is advanced resuscitation. Fifth is post cardiac arrest care. And sixth is recovery. So come to the first link. In the first link, there is recognition and activation of emergency response. So in India, the ERS number is 108. Now the second link is early cardiopulmonary resuscitation, where we are giving chest compression for circulation. Well, the third link is rapid defibrillation. See, defibrillator is hard to get in India. If there is any defibrillator present, then you can attach the defibrillator, then you can use it. Okay, we will see how to use it later. Okay, now the fourth link is advanced resuscitation by emergency medical services and other healthcare providers, which will come along with the ambulance if in case. Okay, and the fifth link is post cardiac arrest care, and the sixth link is recovery, including additional treatment, observation, rehabilitation and psychological support. So now come to the in-hospital chain of survival. In in-hospital chain of survival, what is the difference here is, in the hospital, we already know that which patient can go under cardiac arrest. Okay, so the surveillance is necessary. Rest is, instead of calling 108, we have started a coding system. Okay, like code blue. So rest of the topic is easy now. So now come to the actual topic, CPR. CPR is as easy as calling a CAB. CAB. What CAB means? C means circulation, A means airway, B means breathing. Few years back it was ABC, but now it is changed to CAB because researchers found that there is no advantage of giving breathing until you are not starting the circulation. How do you transport the oxygenated blood to vital organs? Okay, you need chest compression. So it is changed to CAB. So now come to the chest compression. How do you perform chest compression in CPR? Okay, so you should properly place your hand over the lower 1/3 of the sternum without bending the elbows. For an effective chest compression, the force should be come from your shoulders, not from the elbow and not from the hands. The rate of chest compression will be between 100 to 120. Less than 100 and more than 120 is not acceptable because they will not create good ejection fraction, which we need in this case. Depth of the chest compression should be 2 inches, means 5 centimeter. not less than 2 inches means 5 centimeter and no more than 2.4 inches means 6 centimeter. While giving the chest compression, you should allow full recoil of the chest, means we should not lean on the chest. Okay, we allow the chest to come at its normal position and then we have to compress it again. Okay, why allowing of full recoil is necessary? See, there are couple of theories which can explain this thing. Okay, so number one is thoracic pump theory, number second is cardiac pump theory. In initial stage of chest compression, the thoracic pump theory comes into play, where we compressing the chest, there is positive intrathoracic pressure, while the recoil, there is negative intrathoracic pressure, which helps in pulling the peripheral blood in the circulation. If the chest not recoil fully, then the pressure will fall and so the blood supply will hampered. In the cardiac pump theory, as we know, we are compressing the chest, so the heart is compressed between the sternum and the vertebral column. Okay, so while compressing the heart, in the cardiac pump theory, as we know, the heart is pumping between the chest compression. Okay, so what is happening is the tricuspid wall and the mitral valve, they both are closes and there is decrease in the volume of left and right ventricle and the blood flows in the systemic circulation. And during the recoil phase, there is blood flow into the heart. So the next golden point of chest compression is minimize the pause in the chest compression. You will never interrupt the chest compression more than 10 seconds. Now the last point is adequate ventilation, like 2 breaths after 30 compression. Each breath to be given for 1 second. Next point in CAB is airway. There are couple of things in airway. Number one is bag and mask ventilation, in which we need to know the position of head. Number two is triple maneuver, as shown in the picture. Now the last part of CAB, that is breathing. Okay, so breathing, there are couple of points we need to know. Number one is breathing with pulse and breathing without pulse. Okay, so the scenario is patient is collapsed but with pulse, there is no breathing. Then we will give rescue breaths, that is 10 to 12 breaths per minute. Okay, now the other scenario is patient is collapsed. Okay, no breathing, no pulse. Then let's start the algorithm of CPR. Okay, suppose you are in a mall and someone collapsed nearby. Okay, now what will you do? So the first thing first, stay calm and just follow the following guidelines. The first thing is scene safety. Scene safety means the scene is safe for you and for the patient also. Don't run directly to the patient because you don't know what caused that patient to collapse. He may got electric shock, so don't get yourself in danger. This is why we assure that scene is safe. So after you verify the scene, now you will check for the response from the patient. So what will you do is you gently tap on the shoulder of the patient, then check for the verbal response. And what will you ask in the verbal response? Very loudly. You will ask for count. That is, hello sir, can you hear me? Open your eyes. What is your name? Squeeze my hands. Now, if the patient is not giving any response, then what you do is, this is the third step. You have to call for ERS. You immediately call for ERS. In India, the ERS number is 108. It's not 911 and definitely not 000. Okay, these are of foreign countries. And tell someone to get an AED, that is automated external defibrillator. Now you will check for pulse please go for central pulsation and check for breathing. See, there are three pictures now. Number one is normal breathing and normal pulse. You only have to wait for emergency response to come. Now the second picture is pulse is normal but patient is not breathing. In this case, you only have to give rescue breaths to the patient. You will give one breath per 6 seconds. It means 10 breaths per minute, and check for the pulse for every 2 minutes. If any time you feel that there is no pulse, then you have to start chest compression also. This situation normally comes in opioid poisoning. Although this condition is not normal in India, but that should be in mind. Now the last scenario is no pulse and no breathing, or the breathing is shallow, or you can say patient is in gasping condition. In this condition, we start CPR immediately with 30 chest compression and 2 breaths. Each breath counted for 1 second. Till then, if you get an AED in time, then you have to attach the AED to the patient. Check for the rhythm when you attach the AED. How do you attach the AED? I will tell you after the lecture. Now, when you attach the AED, there are two conditions. Number one is the rhythm is shockable or the rhythm is non-shockable. If the rhythm is shockable, the AED machine will self-assess the rhythm and give the shock. After the shock, you have to continue the chest compression for 2 minutes and then you will check for the rhythm again. The AED will tell you when to check rhythm. Before that, you have to continue for chest compression. If the rhythm is still shockable, the AED will give another shock. If still there is no response, then you have to continue CPR till the ERS team arrive. In the scenario when the rhythm is non-shockable, then you have to continue CPR till the ERS team arrive. Now suppose you are the part of the ACLS team and you reach in time at the location, and just assume that you are well equipped in India also. So now what will you do? See, you will come and take over from the rescuer, and now you will assess the rhythm of the patient. Is it shockable or is it non-shockable? Shockable rhythms are ventricular fibrillation and ventricular tachycardia polymorphic. So the first step is give the shock. Please note that every shock will be higher than the last given shock or equal to the last given shock. Immediately after shock given, you have to start CPR at least 5 cycles, means at least for 2 minutes. Now obviously there will be some help with you. So that person will access the IV and give injection epinephrine every 4th minute. And after the next shock given, you will start antiarrhythmic agent like amiodarone or lignocaine. As the recent research said, they both are equally potent. Okay, by the time you also need to find the underlying cause. Now, if the rhythm is non-shockable, what will you do is you continue to CPR, and after the IV exists, you give injection epinephrine, continue CPR. Likewise, you will continue till the rhythm comes or till the rhythm is shockable. So now the question is when to stop CPR. A general approach is to stop CPR after 20 minutes if there is no return of spontaneous circulation, means ROSC, or viable cardiac rhythm reestablished, and no reversible factor present that would potentially alter the outcome. This is all about CPR. Now we will discuss about AED. Okay, if AED is present, how would you attach the arrested patient? Okay, so the AED means automated external defibrillator. All the instructions are given by AED: where to attach, when to attach, at what side the pad should be attached. So there are 2 pads in the AED. Both should be attached to the chest as shown. So what you have to do is you just have to attach the pad after removing the cloths. Okay, and then the AED will assess the rhythm itself and give the shock accordingly. So now come to the drugs. There are only 2 drugs has been approved. Number 1 is epinephrine. Number 2 is amiodarone. The initial dose of epinephrine is 1 milligram. It means 1:10,000. Means 1 ml of epinephrine will be dissolved in 10 ml. And second one is amiodarone is given in VF, pulseless VT, and VT with pulse. Now the last thing